Hi, I'm Laurie McLouth. I'm an assistant professor of behavioral science at the University of Kentucky Markey Cancer Center. I grew up on a small wheat farm in Kansas, about an hour west of Wichita. Most of my family still lives there, and it's a place I'll always feel grounded. I learned a lot growing up there. My family worked hard and was incredibly resilient. The farm taught me to value a day of hard work, whether that was pulling rye, painting a porch, flipping alfalfa bales, or putting a roof on a chicken house. When I was little, my parents bought our small town newspaper. My dad was the publisher, my mom the editor and photographer, and we girls were the staff. My parents involved us from the very beginning. As we got older, we got to take pictures of things that were happening in our town and write stories about people's everyday lives. One of the unique things we did was always print old news, basically stories that had been published 50 to 75 years prior. People really liked it. I think it reminded everybody of our collective history, of how things had changed, of how things had stayed the same. I learned so much from my parents in those experiences. The importance of history, whether thinking about history of family, of community, of farmland, of service, of hearing and telling people's stories, of showing up for the little things that make up people's lives and the stories we tell about them. Developing the sense of awareness of what people were really going through was foundational for me. I didn't go to college knowing that I wanted to study cancer. In fact, I was interested in studying psychology because I enjoyed listening to and learning about people. I ended up double majoring in psychology and Spanish and studied abroad in Barcelona, Spain. And when I came back, I had the opportunity to intern over the summer in the pediatric oncology branch of the National Cancer Institute. And that experience was transformational for me. I saw kids who were coming from all over the world for clinical studies of new cancer treatments. And the clinical social worker I worked with, Dr. Laurie was developing these amazing tools to try to support these kids and their families. Board games and books to try to help them talk about cancer, to understand stem cell transplant, and even talk about death. She also did all these small things like hosted chats for families to help get them out of their kids' hospital rooms and connect them with each other. And she did huge things like co-found a place for kids and their families to stay on the National Institutes of Health campus while they were getting treatment. She was amazing at just seeing what needed done to make a real difference. Watching her, the doctors, and these kids and families going through all of this taught me a lot. It's really where I first came to understand what hope in cancer is. There was hope for a cure, yes, though it was mostly hope for cures to come because of what these brave families and amazing scientists were doing. But I think the most powerful hope was really in those little moments, the interactions between patients and their doctors, time spent allowing a child to talk about and ask questions about death, time spent just sitting with a teenager who wasn't eating and realizing that what she needed most was just food that reminded her of home. Time spent in moments that made people feel normal and connected to life outside of cancer. That's really where hope lived. And that's what I want my research to do. So I study hope in cancer, specifically how we can build hope and the impact that hope can have on people's quality of life and mental health. I want to help people tap into hope during treatment for advanced or likely incurable cancer. One of the programs we've developed tries to do this by helping people think about personal or everyday goals that matter most to them and how they can get there. We help people think about what could get in the way, how they'd respond, what they would do if it seemed like their goals really were blocked because of cancer. Too often, when people are handed a difficult diagnosis, we focus all our attention on their treatment, and the other parts of themselves that are important get really small. Our program aims to broaden that world again, to create just a little more space for people to make sure they're doing the things that matter most, and that we don't lose sight of that while they're going through treatment. To help people remember that cancer doesn't get to rob them of who they are. And people are setting all sorts of goals, from big bucket list type goals to getting out of a wheelchair, to improving relationships, to keeping up with the home and mowing the yard. And these things matter. These everyday things matter. They make us who we are, They make up the stories of our everyday lives. My hope for cancer care is that if we all work together, researchers, doctors, clinicians, communities, we learn from patients to understand how cancer symptoms, treatment side effects, and disease itself are interfering with a person's life, whether it's their work, their family, their social life, including those critical roles and identities that they cherish most, including the things they're afraid of losing, that we'll be able to treat the whole person and keep sight of what makes treatment worth it in the first place.